This is the practice questions related to the community health nursing. So these are questions to consolidate those information to help you understand the content. So we will go through the questions, these 10 questions, and then to show you the content that is you be needed to answer the question. Which action by the learners demonstrate primary prevention? Primary prevention is fixing the problem before doing something to fix the problem before the disease process occurs. During a home visit, a nurse evaluates a client who has a history of diabetes. Okay, patient has a history of diabetes. What intervention means primary? You're preventing further information related to the diabetes, right? Administering medication is you treating the patient. So that's tertiary, right? Teaching a client about meal planning to prevent complication. You're teaching them things to prevent worsening of your diabetes. These sound primary. Checking their blood glucose level during you're doing secondary, that is screening. And referring the client for podiatry for food care is a tertiary treatment. So the best thing is education, planning, and all those things. It's a teaching as primary prevention. Which of the following strategy will be most effective in preventing substance abuse among adolescents? The community health nurse is developing a program to address the issue of adolescent substance abuse. Which of this is most effective? Every time you see most effective preventive measures in terms of community health, always go for education. Education, education, education is fine. Providing scare tactics about the dangers of drug is not a proper education. Focusing on negative consequences is not. Encouraging a lifestyle, this is education. It's a form of primary prevention and positive peer relationship. These are all positive primary prevention strategy. This will help. Implementing strict drug testing policy, screening policy are never the most effective. Which action demonstrate primary prevention? We're preventing the disease from happening. A community health nurse is planning an intervention for preventing childhood obesity. So educate them about things that will make them gain weight. Screening for childhood obesity is a secondary, right? Providing nutrition education to children that will decrease how much calorie they consume is an education, is a primary prevention. Treating existing obesity, that means you already have the disease, is what tertiary. Managing diabetes in obese patients is also treating them is tertiary. The most important initial action was a public health nurse is investigating a potential measles outbreak. So whenever there is an outbreak of a communicable disease, the first thing you want to do is to find the source of it. How do you find source? Isolate all specific cases. It doesn't mean you are not finding the source. You basically identify it, but you don't find where it came from. Determine the vaccination status of the exposed individual will tell you how bad is the outbreak is going to be, right? Treating the symptomatic patient is not the most important initial, right? Report to the state health department is not initial. So find the source, know who, after you find the source, the status of the individual to figure out if are they immune or not immune. So the best thing is not to isolate them. You got to make sure somebody know where you're coming from and then what is their status. That will determine the potentiality or the extensiveness of the outbreak. So individual status is very important. The next intervention the best represent tertiary prevention. That means they have the disease and you're treating them. Giving you flu is a primary to prevent the infection. Blood pressure monitoring screening is looking for a secondary intervention. Cardiac rehabilitation, you have heart problem, I'm getting you well, is a tertiary. Health education workshop is primary. When assessing a community health, which factor is most critical in understanding potential health condition? Determinant of health, there's so many things, but one of them is socioeconomic status, not your lifestyle, not your genetic predisposition or personal health history. It's your socioeconomic status that can determine your health status in the society. When working with the culturally diverse community, the most important nursing intervention is be culturally sensitive as much as possible. So providing interpreters is still not going to be more important than demonstrate cultural competency so that you can address individual culture in terms of your treatment when you be very culturally sensitive to them. Using standardized health material is important. Implementing uniform health protocol is important, but test taking strategy. Whenever you're taking the test and you see a word coach, some word in the question, most of the time the right answer may have the same word in it in a different form. A culturally diverse community, it means you demonstrated cultural competency. A community health nurse is working with a community that has a high risk of what teen pregnancy. We want to prevent teen pregnancy. Which of the following intervention would be most effective in reducing teen pregnancy? Well, increasing access to abortion services will not prevent that, right? They can still have abortion, but it doesn't prevent them from getting pregnancy. You have to be pregnant before you can get aborted. Distributing condom to teenage is appropriate, right? But still, you encourage them to. Um, they don't know about what the the magnitude of what they're doing in terms of the pregnancy. Giving them condom will they can take it all right, but it may not fix the problem. Comprehensive sex education, telling them about what a unprotected sex means and what it can cause, and contraception and lifestyle will be very effective. So this sex education that involve information about contraception and sexually transmitted is better. Abstinence is never an option when it comes to teen pregnancy program. It will fail. So which of the following actions should the nurse take first? The community health nurse is investigating a recent outbreak of food illness. It's the same thing. I changed it. Look for the source, find the status of the if it's something communicable, see what is their vaccination status. If you interview the people who are here, you know what they eat, where they went, and where did they get a disease from. Contact food sample from local restaurant. Well, that's a broad view of it. It's not perfect. Notify the local health. We can do that, right? Educating the community about food safety is fine. This is the end of it. But to find the source is to talk to the people. To find the source. Gathering information from an affected individual is crucial for identifying the source of the outbreak and implementing appropriate control. Which population is considered most vulnerable in a health disparity? Middle-aged class working, suburban residents, homeless individual, college student, of course, homeless people don't get it. This is the end of it. Thank you for watching and good luck in your exams.